Betty, I'm Sarah. I'm going to be your nurse today. I'm here to insert a Foley catheter. Is now a good time? Great. Could you verify your name and date of birth for me? Awesome. I am going to provide privacy for my patient. And then I've already raised the bed, but I would have raised the bed. While I'm doing so, I can explain the procedure to my patient and ask if she has any questions. If not, I'm ready to get the patient in position. I'm going to do hand hygiene. And now I'm ready to uncover the patient. And I'm going to position the patient in the lithotomy position. While doing so, I'm going to do my best to keep her covered until I need to uncover her. And then at this point, if the patient was unable to get into this position, I would just ask for help from another nurse or two. So now I am ready to open up my kit. In this bag I would just fold it down, and I'm going to use this for garbage. And I'll just keep that at the foot of the bed. And now I'm ready to open my sterile field. I'm also going to expose my patient now, just so we don't have the gown in the way or anything. So I'm going to pull away from me, and at this point I can have my patient assist me by just putting her foot underneath. These are my gloves. I'm just going to set these aside for now. And this is the other chuck. I am going to place this one closer to the peri area, and I want the shiny side of the chuck on the bed.
And then I would describe the dressing and the discharge and everything from it using the taco acronym. So
Okay. And I'm going to set this aside because we don't use that. And now I'm ready to put my sterile gloves on.
So I would wash my hands again, and then next I'm going to do a culture on it. And I don't have the packaging or the top for it, but I will act like there is. So it's going to be in here. So you carefully take the top off, and then either hold it or throw it away right. Carefully grab this and you swab it from east to various. So I would slowly get it on a circle. And then you just grab this up and
And now I have my sterile field open. I'm going to remember to keep my hands above my waist. Now I can move this and flatten this with my sterile hands. And I am ready to prepare my kit. So, going to open my
Here
lube.
I have my two wood applicators, and I would have one of these.
And each time I throw something away, I want to make sure I'm out of the
So my
sterile field.
things are already,
And at this time, I would also ask my patient if
and then I would
she is
separate
allergic
the
to
sticks.
iodine or
So
latex.
just grab one of them, pull it out, and I'm going to measure it. So since this one is a circle, I'm going to do a diagram. Put it down the middle, and it's easier to lay it flat the skin. And I would flip, and I would say it's more than centimeter diameter. And since I did use the radial measurement that's in centimeters, I'm going to just stick to in centimeters. So I'm going to check
And this specimen container we will not use in this presentation, so I would just set that aside. And I am going to position this onto the catheter so that it is ready to go. So after I contaminate the one hand, it's easier. Now I'm going to very carefully remove this plastic, making sure that I'm holding firmly onto the catheter so that it's not flailing around. I don't want to decontaminate it. Okay, and I am actually going to put a little bit of hand sanitizer into my tray. This would have decontaminated my gloves, and this is not a step in a real situation, but for the mannequin's sake, I'm going to do that. And now I'm ready to clean my patient. So I'm going to put my hand on the labia, and once my hand is here, I cannot take it off. If I move my hand, it would be considered decontaminated. So with the first iodine stick, I'm going to clean from the top to the bottom, farthest away from me. Get out of my sterile field, throw it away. Closest to me, top to bottom, out of my sterile field.
Next, I'm going to put the saline into the Acrylex.
And top to bottom, in the middle, out of the sterile field. And now I am ready to insert the catheter. So I would lube the catheter. For demonstration purposes, I'm going to use hand sanitizer. And I'm going to explain to my patient that you're going to feel some pressure. I just need you to relax and take a deep breath. And inserting into the meatus, I'm going to insert moving towards the umbilicus, and I'm going to insert it until I see urine flowing out. Once I see urine flowing, I'm going to insert for another 1 to 2 inches. And then I'm going to move my hand away, grab the end of my catheter. I want to hold it in place so that I can inflate the bubble.
Same way, but this packaging is not sterile, so you don't be most careful with just this outside packaging and this. I'm going to throw this away.
While I'm inflating, I want to ask my patient if she's feeling any discomfort. I want to make sure that she's not in any pain.
Around the outside of the gloves.
And then once the syringe is completely empty, I'm going to tug on it. I want to make sure that the catheter is in place, that the bubble is full. Now I can remove the syringe, and I would place this into a sharps container. Now I am ready to clean up.
I'm going to grab the cup from this one, step back.
patient isn't being very cooperative. That's okay. Okay.
The next step would be take the coax.
And now to secure the catheter in place, I would tape at the Y intersection on the patient's thigh, leaving some room for her to just move around, some flexibility. And then with the bag, I'm going to hook it onto a non-moving side of the bed. And now my patient is comfortable, hopefully. I would make sure of that. And I would cover her. I would throw all my supplies away in the garbage except for the syringe, which would go into the sharps. I'm going to cover my patient, make sure she doesn't need anything else. I would lower her bed, give her her call light, and then I would go document.